This video is a beginner's guide to the use of the electronic patient care report form. The technology of the ePCR looks at the interface being hardware, demonstrated in person interactively, and the software that comprises of what is viewed on the ePCR that will be covered in these slides. Once a patient has been generated to the ePCR, the device requires various prompted information. Each time a patient is selected and the tab opens, the ePCR is defaulted to the home page. This page consists of patient details, next of kin details, patient escort details, facility information, incident information, navigation information, medical aid details, refusal of treatment and/or transport, declaration of death. In order to move to any other component alongside the homepage, patient demographics needs to be completed first with the most basic critical information being name and surname. If this is unavailable, select the unknown square. Patient gender, age, and age type is equally important before attempting to complete information such as vitals or history. Always add patient weight into the respective box. Only officially recognized abbreviations may be used. Once patient details have been completed, obtain an initial set of vitals as early as possible by selecting the Vitals Obs tab on the bottom far right corner. When this page opens, select the time and complete applicable baseline vital signs like that of respiration rate, pulse rate, oxygen saturation, blood pressure, temperature, capillary refill, HGT, and F2. Patients who are triaged red are required to have at least 3 sets of vital signs recorded as per standard operating procedures, 1 at Alpha, 1 en route to Bravo, and 1 at Bravo. Certain tabs may expand for more elaborate detail, like that of ABG results, pain evaluation, and GCS. After the first set of vitals have been taken, the patient can immediately be triaged for early prioritization. The ePCR does an initial triage presented by the square color box on the right side. A discriminator color has to be selected and may be equal to or upgraded to the automated color. In addition, triage discriminators may be added to indicate where the patient's condition presented urgent, very urgent, or an emergency. Moving on to the patient history tab on the left-hand side, there is a list of information required under each label. These labels are chief complaint, allergies, current medication, past medical history, and last oral intake. The chief complaint should be used to record information related to patient history, detailed patient history, event of a transfer, assessment, management, and interventions performed prior to your arrival. Alternatively, add a picture of the healthcare facility notes. Ensure that the working diagnosis is closest matching the patient diagnosis. Once the patient history has been completed, the next tab on the left would be the primary survey. Once selected, there will be 4 segmented components within the primary survey. This consists of the pose, the position in which you found the patient, the airway, the breathing, and the circulation. Under airway, it is required to determine the patency of the airway and the maintenance of the airway. For each subheading that has an asterisk next to it, the component is compulsory. Under the breathing section, we inspect, palpate, auscultate, and percuss. For abbreviations like NAD, it refers to no abnormalities detected. If the block that is labeled Other is selected, a bar would show up for you to input what your findings are. Under circulation, the skin, hemorrhage control, and pulse characteristics are important. Following the primary survey, a secondary survey is required. This is whereby detailed information can be depicted. The animation is used to graphically represent where the injuries occurred, whereas the detailed secondary survey tab allows for you to input on the taskbar what the findings are. Wherever a square is present, you are able to select more than one. When there is a circle, you are only able to select one. Under airway, if multiple methods were used, for each method, a detailed box would pop up in order for you to provide more information regarding the intervention. This is also applicable for the breathing, circulation, and disability component. If the patient is placed on a mechanical ventilator, under treatment, at the breathing section, select ventilator to document applicable mode and settings. Ventilator settings to be documented would be that of the referring facility, what the settings are during transport, and if any changes were made. If the patient was placed on a mechanical ventilator at scene and the mode and settings remained unchanged, only document one set. If any changes were made, complete another set. Under medication and infusions, EMS providers logged onto the ePCR would have the scope of practice already documented. Based on that, whichever provider administered the medication, they will only be able to select the medication type within this scope. The progress notes now offer dedicated headings specific to the patient interaction and journey. These headings include on arrival, whereby a visual autopsy is documented, how the patient is found, current vitals, attachments, indwelling catheters and infusions, and hospital ventilator settings, if applicable. Assessment and management include all assessment findings, all interventions performed, recorded in a sequential manner, following an ABCDE approach. Clearly differentiate between assessment and management, ideally submitting these as their own entries. If feasible, acquire photos using the ePCR photo function of the referral letter, ventilator settings on arrival, vital signs on arrival, and any other patient pertinent or relevant findings. Paperwork should be completed as per scope of practice and patient care demand. During transport, document any new deviations, derangements found on assessment, and interventions performed. At facility, document handover procedures, deviations from standard practice, prolonged waiting times, near misses, adverse events occurring at the receiving facility. Consultation, if any consultation took place, document practitioner details and instructions. Use these dedicated headings where applicable. Patient safety may include documenting any patient safety related incidents or patient safety concerns, near misses, or adverse events that occur during or prior to your management. Avoid using terms such as stable. This is subjective. Rather define exact parameters of instability. The term uneventful may be used. This is defined as no interventions provided. Use in context. Transfer uneventful. This means that after you loaded the patient, you did not provide any interventions en route. In the event of a cardiac arrest, the resus tab is selected. This is to timestamp the activity provided. If medication is selected, this is only to document what was used and not document the concentration or the amount. That would be documented under the treatment tab. For resuscitation, this section works well in maintaining a log of events. Other useful tabs on the ePCR includes that of refusal of treatment and or transport and declaration of death. When the patient refuses treatment or transport, it matches that of what is in the refusal book, whereby the patient is able to sign on the ePCR to refuse treatment. When the declaration of death is completed, it is important that the declaration voucher is also written out and a picture taken using the ePCR would be attached of the voucher. Selecting the appropriate image type, it would link the declaration voucher to the declaration of death completed on the ePCR. For the declaration of death, one set of vitals is required. Once completed, return to the Declaration of Death tab and submit within that component. When a patient transported has been completed, the Disposition tab under Submit ePCR is the last component to be completed. This is a compulsory component. If there are tabs that have not been completed, at this point, the ePCR would prompt for you to return to the appropriate section. This will divert from this screen back to where the input is required, having no information listed under the disposition until all tabs that are applicable have been complete. Information often omitted is facility information. Once you are ready to submit the ePCR, if it doesn't allow you to submit, it will prompt that there is information that needs to be completed, like that of facility information. Select the tabs to give you a drop box of the appropriate facilities as well as the ward where the patient is required to go. Very important, at patient details, provide the start odometer readings so that once the disposition is completed, the end odometer readings would be input at the receiving facility. Document the initial and surname of the provider receiving the patient at the facility. The information below depicts how the ePCR stores the information in PDF format once the call has been submitted. This is the end of the beginner's guide. Thank you for your time.